Welcome to the What's Happening Birmingham video podcast.
Hello, everyone. This is Jarvis S. Scott with What's Happening in Birmingham. Today, I got the honor and pleasure and my first national guest, CNN Medical Analyst, and also Emmy Award-winning health reporter, epidemiologist, and medical doctor, Dr. Seema Yasmin.
Hey, thanks for having me.
Great. Thank you for coming on the podcast. One of the reasons I wanted to bring Dr. Yasmin on is to talk about her new book, which is called Viral BS, Medical Myths and Why We Fall for Them. And also just kind of get her thoughts on the ongoing COVID-19 pandemic. So Dr. Yasmin, let's kind of dive in. So what was your inspiration and goal for writing this book?
So people are saying to me, oh, your book is coming out with such good timing. It's coming out during the pandemic when there's so much misinformation circulating. But actually, I started writing this book about 6 years ago because it's not a new problem, unfortunately, that we have so many medical myths and health hoaxes. I'm trained as a public health doctor and as a disease detective and a journalist. So I'm just really passionate about making sure that people aren't vulnerable to misleading headlines, to misinterpreted scientific studies, and that people just have access to the most accurate and the best available information about health and science. It's really not just about disease. It's not just that puts our health at risk. It's also a lack of information or inaccurate information about health and science that, as we've seen in the last year, can be dangerous and even deadly.
Okay, and like I said, I bought your book, really good read. And you covered like a lot of common medical myths out there. And like I tell everybody, go get the book today, get on the website, also get it on Amazon. I just want to talk about a couple of the topics you talk about. Like the first one you talked about was, do vaccines cause autism? And what was kind of like your findings on that?
So vaccines definitely do not cause autism. It's something we can be certain about because there's been really big studies, millions of children looking at the fact that vaccines protect kids from quite dangerous diseases and don't cause autism. But the reason that there's a chapter about that in the book is because I still get asked this question a lot. So much of it stems back to the 90s and even earlier, but in the late 90s, there was this really famous study that was published. It was fraudulent. It was unethical. It was an experiment on kids that never should have happened. But unfortunately, it got published in this big journal and it kind of set the stage for even more disinformation around vaccines and kids. And so a lot of people out there, believe that vaccines are toxic and that they cause autism when they don't. And I think it's also really telling and really ableist that people are like, I'd rather my kid die of measles than have autism, even though vaccines don't cause autism. So it just goes to show how viral a myth can go, how long it can persist for, and how much work it takes to really debunk that.
Yeah, another one, this is real common, but I think everyone can relate to this one, is how long can you eat leftovers?
Yeah, so there's different topics in the book for sure. So that one, may sound a bit trivial, food poisoning, whatever, but about 50 million Americans get really sick with food poisoning every year, about 1 in 6 of us. So this chapter kind of goes into details about different foods and different kinds of bugs that circulate, even really dangerous ones like E. coli and salmonella that can knock out your kidneys and stuff and send you to hospital. So there's resources in that chapter about like what particular food you're looking at, how it was prepared, how it's being stored, so that basically when you can throw something out or when you should keep it.
Yeah, and then another one kind of leads to something everybody kind of take, especially we've been hearing about now, the whole vitamin D and the myths that, does it protect against obesity, cancer, and pneumonia?
Yep. So this is something that keeps being studied and a lot of doctors are in disagreement about it. In the UK, there's been this long-standing evidence. If you're Black or you're brown, you're a person of color, then you need to have vitamin D supplementation, especially in the winter months, because our brown skin means that we don't absorb as much of the sun's rays, and you need that to make vitamin D. Quietly, in the last month or so, the UK changed that guidance to say that everyone, regardless of your skin color, should be taking vitamin D supplementation based on some more evidence. But myself, and I think some other people are still like, I don't know how convincing that evidence is. Certainly, the studies about vitamin D and obesity and cancer to me are not convincing. We know that it does play a role in our immunity and like having a strong immune system, but does taking a vitamin D supplement actually make you more resilient to COVID-19? Like, I don't think that's conclusive. And I just worry that people would think, I'll just take a vitamin tablet and then I'll be protected. Like I can maybe not wear my mask or, go to a gathering. And we don't want people kind of letting down their guard like that.
And like another thing you kind of talk about also in your book, you even talk about mental health. And one of the chapters you devoted was, are there more suicides during the holiday season?
Yeah, there's a couple of chapters on suicide, actually, because I think this links into this idea that we're really bad in our society generally at talking about mental health, even though it's so common to have anxiety, to have depression, like it's very, very common. But there's so much stigma and taboo that we don't talk about it, or we don't talk about it well. That then fuels a lot of these myths. So then, like me, if you're writing a book about medical myths, there's a lot to debunk about mental health and suicide. So there is that chapter, and it's been around for a long time. It's even been reported on in like some reputable news outlets that suicides increase over the Christmas holidays and New Year's. It's actually not true. And that maybe that feels counterintuitive. People might think, oh, I don't know, isolation or stressful family gatherings, whatever, but actually suicide rates are higher at other times of the year.
So like, in your opinion, over the past year, how has the myths about COVID-19 has changed a little bit?
I mean, it hasn't changed in that the myths have been there from the beginning. They are still circulating now. There's conspiracy theories. I think what's felt different over the last year is that some of the misinformation and disinformation was very dangerous and coming from the president, right? So there was this research out of Cornell University where the scientists looked at 38 million English language articles about COVID-19 and found the single biggest driver of false information about the pandemic was Donald Trump. So I think that was very challenging, because how do you counter that when that person has, at the time, a Twitter account with millions of followers and can have press conferences whenever they want? The thing that changes is that the myths themselves evolve over time. As vaccines came along, you started seeing more specific anti-vaccine conspiracy theories. But what's not different is that the medical myths and the health hoaxes are out there, and we have to take them as seriously as we take the infection.
So now we get into the vaccines that have been, rolled out and, phases and things, but now people develop more of a hesitancy for it, and now it's myths with that as well.
Yeah, I would say some people are vaccine hesitant. Many others are like, nope, I've seen the data. I'm convinced. People I know who I trust have gotten it and are telling me to get it. So many people want to get it. Right now, it's almost like we have an issue around access. Just get the vaccines out there more than we have an issue around hesitancy. We may come up against hesitancy maybe in the spring once more vaccine doses are distributed. I think one of the things that frustrates me as someone who's been studying the anti-vaccine movement and vaccine hesitancy, which is less anti-vaccine, but more like, oh, I'm on the fence. I've been wanting people to talk about it for a long time, and now it's in the public sphere and we're talking about it. It's almost getting simplified. So what I hear a lot of now is like, oh, Dr. Yasmin, vaccine hesitancy is really important. Black people are vaccine hesitant, right? And it's like, no, like Black people are not a monolith. My community of South Asian people, we're not a monolith. Among us, we have many different perspectives and points of view. Certainly Black people in America and other Indigenous and POC communities have very legitimate reasons for not trusting scientists, for not wanting to be experimented on, for not trusting doctors, even historical and present day reasons. But I think it can kind of get oversimplified, like all people of color are anti-vaccine or vaccine hesitant, and that is definitely not the case. Many of us want the vaccine.
So why do you feel like, during your writing this book, why do people keep on falling for these myths? Even if all this new tech,
Yeah, because I think we can get deluged with information, and it can be very tricky to separate accurate information from false information. And also because even what we might consider trustworthy, reputable sources of information don't always represent us equally. So for example, my family are very, very devout Muslims. And so often, my family also like to circulate conspiracy theories. And sometimes if I want to be like, oh, that's not accurate, here, check out this article about vaccines from the New York Times, I have to bear in mind that the New York Times, and this has been documented for decades, really misrepresents Muslims. really does a bad job in accurate and fair reporting about my community. So therefore, it's not so easy for me to say, just trust whatever you read about vaccines in the New York Times. You know what I mean? And so it gets more complicated than this idea that, oh, people believe something based on false information. Just give them correct information. Actually, that can backfire, as I explained in the final chapter of the book. So you can inform people, you can raise awareness, you can debunk myths, but you have to be careful, personalized, and localized by how you do it. You shouldn't treat people like dummies. People have legitimate reasons, like I said, but not always trusting the information that's given to them. And you have to empower people, like give them information and then empower them to make up their own minds.
So yeah, and one thing I like, you got the BS detection kit. What was your thinking behind? Because I like how you talk about this in the book, all different chapters, but you actually kind of come out with like when you have these discussions with people, a step-by-step process.
Yeah. So basically, just to wrap this up, you can read the back of the book to have this BS detection kit that kind of gives you a guide that when you read something that seems too weird or too good to be true or very new, you have this set of steps, this toolkit in the back of the book that kind of gives you a guide as to, is this accurate? Is this not? What questions should I be asking?
Okay. Well, any final thoughts you would like to add, Dr. Yasmin?
Just bear in mind. Yeah, I mean, get the book. You can go to my website, seemayasmin.com, to get it there, anywhere that books are sold. And just bear in mind that everyone is susceptible and vulnerable to believing stuff that's false. It's not this idea of like, oh, if you're educated, you're not vulnerable. I wrote an op-ed for the New York Times a few months ago about how doctors and nurses are falling for COVID conspiracy theory. So it's really important to protect yourself from the virus, of course, but also to make sure you're protecting yourself against health hoaxes and medical myths about the virus too.
Okay, well, Dr. Yasmin, thank you for coming on today. One thing I want to add too, I love your career path and journey and how you have evolved, because a lot of times you go from working at CDC, now you're a journalist, then you're on TV and things. I love to kind of bring you back to kind of talk about as far as your career path, but also kind of talk about, COVID, how things are kind of evolved, especially with the different vaccines, like the differences between them. So I'd love to bring you back in the future.
Okay, I'd be happy to. In the meantime, take care and stay safe.
All right, well, thank you all for watching this video. Please watch what'shappeningbirmingham.com for more videos, and don't forget to subscribe to my YouTube channel. Thank you all again, and have a great day. Bye-bye.
All right, thank you. Bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.